Okay. Okay, so thank you everybody for coming to this week's meeting of the Naughty Psychedelic Society. The topic of this evening's talk is about psychedelic support in a music festival setting. From what I gather, there are very few organisations that do this. I suppose I'm only aware of Cosmicare being the main one that has this particular sort of angle in this country. So it should be a very interesting talk. So our speaker is Guy Jones, who's a chemist and a volunteer with Cosmicare. So thank you, Guy.
Thank you very much for the introduction. I'm going to talk to you a little bit today. I'm a trustee of Cosmicare UK. We are a psychedelic welfare charity based in the UK. There are also other organisations in other countries in Europe, and the US MAPS run the Zendo project. But to the best of our knowledge, we are the only service of our kind within the UK. If anybody knows any different, please put us in touch. As Ollie said, my background is as a chemist. I came to Cosmicare just as a sort of regular volunteer. Turned out that it was really something I really, really enjoyed doing, and I had some skills to contribute and gradually became more and more involved through that. And that was in 2012 that I first volunteered with them, and so I've been going ever since and roped in doing more and more stuff ever since. So what I want to talk to you today about is I'll give you a little bit of a rundown of who we are as a charity, as an organisation, what makes up Cosmicare, the work that we do at events, the kind of patients that we would typically expect to see, and the approach that we take, so kind of as a part of our work, the approach that we take to treating them and getting them back to the party. How many of you have a medical background here today? Oh, that's good. Okay. So I've tried not to make it to, I've tried to kind of start from the bottom up, so there probably will be some bits that you are very much already familiar with, but I think it's important to make sure that everybody understands the context of it to understand why I think the work that we do is very important. Excellent. I'm going to mostly focus on severe cases. They are certainly the more exciting ones. There's more to talk about there, and they can be the more impactful ones. It's worth bearing in mind that the cases that I'm focusing on today and the type of treatment that I'm talking about is probably a significant minority of the work that we do. So we have an awful lot of patients who maybe they just need a little pointing in the right direction rather than a full kind of one-on-one session. And apologies for the lack of images. It is a bit plain and texty, so you will try to have a nice background in view of that, because obviously we don't allow photos to be taken while we're kind of running the service, because if you think people are paranoid without you taking photos, you should try getting the camera out and taking photos of them. There's not a lot of stock images either that are really suitable for this kind of thing. So yes, it could be a little bit dry, but I'll try and keep it fairly upbeat. There's some pictures in the beginning at least. I've tried. So we're a small charity based in the UK. We have become a charity as of March. Up until then, since our founding in 2009, we were just a community group, and so we weren't eligible for lots of different things, and we've really, to improve our legitimacy, because of the nature of the work that we do, a lot of people sort of think, a bunch of freeloaders trying to get free festival tickets. There is an element of that, but we do also do very professional work as well. We're 100% run by volunteers. Nobody takes a salary. Nobody has this as their full-time work. It can make it challenging at times, but it's also incredibly rewarding, therefore, when it does get pulled off correctly and on time. We have had, to date, no government grants, and there are none on the horizon either. It's work that has grant applications, as I'm sure some of you are probably aware, is something that we've isn't necessarily what we want to be doing with our time. We want to be out there treating patients, and we don't need to be doing our day jobs in the winter, so it's not something that we've been able to focus on. We have had a very kind grant from the Breaking Convention Foundation, and we do some we have a little donation box at festivals, and last year for the first time we've also been the benefactor of a benefit event, a festival at the end of summer, which has been absolutely fantastic for us because we've actually been able to have some things that we need, which is really great. So there are 3 trustees, myself, Ben Holden and Karen Salenzi. We do a lot of the kind of winter work, out of season, organising events, and then we also have one other helper who's just joined us with that. And then there are 3 other core members who come with us to every single festival and sort of lug all our stuff around very kindly for us. We then have about 20 what I would call shift leaders, so people who have volunteered with us on multiple occasions and kind of have a good foundation of what they're doing, and they can take control if things get really challenging. And then on top of that, we have loads and loads of new applications each year. Has anybody here applied for Cosmic Air UK? 1, 2, wonderful. So we had over 100 applications this year, of which 90 were completed, and that's including those, so about 70 applications that we have to go through and really kind of get to know the person on paper before we can consider them as a volunteer, so it can certainly be challenging on that aspect. So what do we actually do? I suppose I should have introduced this a little bit better before the last slide. Our primary role is to attend music events and care for patients who are experiencing a bad trip. That can take a wide variety of forms, and we will treat patients who have as simply as lost their wellies and are in a welly-related emotional crisis, all the way up to patients who may be naked, screaming, running around. So there's a full spectrum of work that we do. We really specialise in psychedelic drug cases, and that's an area, as Ollie was saying, that I think is underrepresented in other welfare services. So our experience is really where we, I think, is what allows us to separate ourselves a little bit from other welfare services, although with the best will in the world they will certainly try to treat severe psychedelic drug cases. That's not always easy when you have no concept of what a person is feeling and going through, and why they're saying the things they are, or why they're unable to communicate even though their EKG appears to be absolutely fine. So this is our somewhat unglamorous setup, but it certainly does the trick. We have a really nice bell tent that we use, which is wonderfully decorated inside. I'll show you a photo of that in a minute. And then we also have a large separate, it's an army tent that is also tastefully decorated. You make the best of what you've got, really, for patients who may need to sort of sleep things off, who aren't emotionally sensitive but perhaps just need somewhere to stay for a night because they can't find their tent or whatever's happened. And so this is our setup at night, which suddenly looks a little bit more appealing when you can't see that there's holes in the tents. We really try to make it a place that if somebody is coming to, then it's not a white, sterile medical tent. Not that there's anything wrong with that, but we like to make it as appealing as possible. We're not so worried about sterility because we're not treating patients who need that, and so we can afford to have soft lighting and nice decorations. So you can see this is the inside of the bell tent. You saw before, it's actually not the bell tent, but it certainly gives you the image. We have some nice sort of cushions. There's a shrine in the middle, which is completely non-religious, so it's something that's quite important to us, and I'll come on to a little bit later on. It just has sort of incense, trinkets, toys for people to play with. There's usually a deck of cards there, just sort of bits and pieces that are interesting for people and might comfort them. You never know. Yeah. So I start to get in a little bit more about the approach that we take now. We are very much, and so this is kind of coming back to the point about the experience that we have in treating patients and the ability to empathise and understand what they are going through in a way that we feel that other welfare services may not be able to. A peer is a person who is able to empathise with somebody going through something. So if you're being treated by someone and you really feel that there's a connection with them, you're much more likely to trust them, to be willing to explain to them that, yes, I have taken a drug and this was what it was and this was what the time is that I took it. Ideally, the peer will have some inside knowledge, as I say, of what the person is going through. And so through those things, we hope to build that bond with somebody to enable us to treat them a lot better. Whereas if you are a person who is undergoing a difficult experience and you come into a medical tent and you see all these uniformed people around you with sort of stethoscopes, you sort of, without trying to project onto people, it's almost a them and us situation, whereas when I'm working with Cosmic Care and I'm on shift, I have the most horrendous rainbow woolen knitted jumper, really just trying to put people at ease and make them feel like they're kind of home, if you like, and they can relax and they're going to be safe. So we don't wear any high-vis stuff. We have a little low-key name badge, so if people are forgetful as a result of whatever situation made them that way, then they can remember our name. But other than that, we look very deceivingly like other festival goers, which it does cause confusion when sort of maybe the police come over for a briefing in the morning, or other organisers of the festival, and they're sort of like, does anyone actually work here? Is this an attended stall? So yeah, it's kind of what we're going for though, and they usually get it once we explain it to them. So as a part of that, we have quite, and as I mentioned before, quite a rigorous volunteer selection process. Feeding into the peer approach, we really, it is absolutely necessary that a volunteer has an intimate knowledge of psychoactive substances and ideally even has experience with psychedelic drugs. It makes it a lot easier to empathise with the patient and understand what they're feeling if you've felt it before. And so it's difficult for us to vet people remotely. And so this is one of the ways that we can kind of check whether or not they're going to be able to empathise with people. And so also, not only on that level, but on a more general level, the volunteer needs to have a generally empathetic and caring nature. We need people who are, a little tagline that somebody came up with last year, relentlessly kind. No matter how frustrating somebody's repeating of the word turnip may be, that is an actual case that I've dealt with, you need to be able to, sure, I'm not annoyed by that, do you want a cup of tea? So yeah, it takes quite a lot of patience and an ability to click with people and work with them through the experience that they're having. So teamwork skills, obviously when we are on site we are a team and we need people who are willing to muck in. If there's a busy shift, then ideally there will be a volunteer around who's not necessarily on shift but sort of will say, oh, don't worry, I'll go and do the washing up for you so you guys don't have to deal with that. So a key kind of skill for life, really. A little bit of knowledge of first aid. It's not essential because we are on site to complement conventional medical services. It's not a requirement. If ever we feel like a situation requires proper medical qualifications, we have a radio link to medics and we can ask them, can you come and check out this patient because I'm worried about X or Y. But we do need people to be able to cope and keep a cool head in a situation where that's happening, if a patient's really deteriorating and the team is worried about them, then it doesn't help to have people who are incredibly panicked by that and run off and disappear. And there's also, I mean, the last point is kind of a catch-all for everything else. We ask volunteers to fill in a very detailed assessment form, and we will read through that, and unfortunately it's not a science. We have to use our kind of gut feeling to assess whether or not they are generally suitable for the work that we do. And it seems to work fairly well, and most people will, most of the people who apply for Cosmic Care we find are suitable. We don't find that there are people who are sort of really mean and hate working with other people. Those kind of people aren't interested in working with Cosmic Care, so it kind of makes our job a little bit easier, or makes it harder depending on how you look at it, because it's really hard to differentiate, and if we've not got enough spaces for an event to fit somebody in over the summer, it can be really challenging, and it's really sad for us to have to say, unfortunately, there's not an event that we can bring you to. So, why do people use recreational drugs? There are loads and loads of different reasons. I've tried to cover a few of them here that will encompass the sorts of situations that people are in at music events, and I think the primary one there is to enhance pleasurable situations. People who use drugs aren't just vulnerable people, they're not just, they haven't been tricked into it, it's not just peer pressure. People genuinely use drugs very often because they want to. They're at an event, it's their 1 or 2 weekends off a year that they can really let loose, they can wear crazy clothes and they can listen to the music they love, and so as a part of that, they may choose to take drugs. On the flip side, there are people who are taking drugs to escape an unpleasant life situation. That is the nature of what we are as human beings. We will sometimes shy away from issues rather than confronting them, especially if they may not be particularly easy to confront. Some people will experiment for the sake of experimentation, and festivals are often a place where people feel that they can do this. It is a sort of a separate environment and almost a little bit of a bubble from everyday life for a lot of people, and so if they're going to try something new, then very often it will be at a festival. And there are those who will be tripping with a deliberate intention to try and facilitate personal growth, to try and confront a problem rather than escaping from it. It's something that we probably see less at festivals, certainly the larger festivals, but smaller events where we get a lot of kind of regular festival people. It is something that we come across, and I'm sure it's something that happens as a part of the wider festival as well, with people who don't come into contact with us. And then, of course, there's any combination of the above. They may be enhancing a pleasurable situation, but they may also be going through something difficult in their life. And so those two issues, there's not any one that you could necessarily pick out. And I'm sure there are others as well that I haven't covered here, but these were the ones that I felt were kind of most prominent. So, as a part of that, there are always risks associated with drug use, and people don't choose to use drugs generally because they feel that drugs are safe, but because they feel that the benefits of taking drugs outweigh the risks of taking them. So be that to escape pain or to enhance a pleasurable situation or whatever it may be, they will feel that the positives outweigh the negatives, and that's ultimately why we would choose to take any risk in our life. So, yeah, there are a number of common risks. The first one there, adulteration and misidentification, is something that probably is less common at the moment in the UK because of the prevalence of very high-strength MDMA, but it certainly does happen, and it is something that we see at Cosmic Care. People will take a blotter which they believe to contain LSD, and perhaps it contains a phenethylamine which lasts twice as long, and very often that will result in them ending up in our care because after 14 hours they're still in the middle of a full-blown trip, and that's a little confusing. So polydrug use is another one that very often catches people out. People don't necessarily click that the drugs they took last night are going to affect them when they take something in the morning. And so that's another one that we often come across. As well as that, the interactions between different drugs may create a kind of 1 + 1 = 3 effect, where they potentiate each other. And so when somebody's taking a normal dose of MDMA, which is something they've taken before, and a normal dose of LSD, which is something they've taken before, when they take them together, those two normal doses become a lot stronger than what they would expect to experience. Pre-existing medical conditions will also affect drug use. Certainly with the work that we do, psychiatric conditions are obviously something that can potentially increase the risk. People who suffer from psychiatric disorders still go to music festivals, still want to enjoy themselves, and still take drugs. Generally, they get away with it. Sometimes they don't. That's an unfortunate reality with life. We're there to catch them and help out and set them straight and get them back to the party. And then there's also a reckless attitude towards substance use. It's another one because I feel that it occurs more at music festivals and events because, again, it's that sort of bubble that's a bit separated from everyday life. People feel like they're in an environment where they can get away with things that they might not normally, and so they may not be as careful as normal. There's also the issue that people don't try and take a set of scales into a music festival to weigh their doses, because if you get caught going through the gates with that, then you ain't going into the festival and you might be going home in the police car. So there's a kind of a pressure for people to not weigh their doses, and then on top of that they may have been drinking and decide to kind of a bit more consciously be reckless as well. So lots of different things that can create issues. And at music events, these can be further compounded when you're at home with a few friends. It's comfortable, you know where everything is, you can go to your bed at the end of the night. Things have a bit more of a tendency to stay on an even keel at a music festival. I don't know if any of you have seen the pictures of Glastonbury over the last week. It could be wet, muddy. At Secret Garden Party last year, there was torrential rain for about 36 hours. The whole site was just revolting, and we treated more cases of cold, wet people whose tents were unsleepable than we did of drug use. I can't say I blame them, because it wasn't a particularly pleasant environment that you would want to enhance your senses in. So there's a few sort of risk factors as well as that at music festivals. You're also in a very large and isolated location, so as I say, you can't just pop home for the night to your nice warm bed and have a warm shower in the morning if you're covered in mud. And there's also the potential with that to lose one's friends if you haven't set a meeting point, and you're at a festival of 20,000 people, and if your friends don't have the same idea as you to go back to their tent, then you might not see them again because there's no signal on site, and when there is signal, everybody else is trying to send a text message as well. Sleep deprivation is another one that I think is perhaps underestimated at other events and in other drug use contexts, but certainly at music festivals, if it's somebody's 1 or 2 weekends of the year where they're really, they can really let go, then they may not want to waste that time by sleeping. And so we very often see patients who come to us and they're sort of a bit confused about why they're feeling unpleasant from not necessarily having taken loads of drugs, and you ask them when they last slept, and they said, well, the night before I came to the festival, of course. So it's certainly something that can really play into psychiatric issues, and there's, even without drugs, there's a risk of paranoia on its own, so it's something that we do have coming to us. A lot of sensory stimulation at music festivals, very loud music, lots of flashing lights. Even in the daytime, you've got people walking around doing sort of performance art, strange things, strange clothing, and so it can be an awful lot to take in if you're on drugs that enhance your senses. And lots of strangers as well. This is something that maybe in an everyday drug use context might be more of a problem than at a festival, because at a festival generally a lot of people are on the same wavelength. You can chat to the people at the tent next to you and they won't give you a strange look like they do on the tube. So it's something that's less of an issue but can still create challenges for people. And so all of this increases the need, well, I guess with the exception of the last one, all of this increases the need for support at music festivals in comparison to a sort of at-home context on an everyday basis. So psychedelic drugs, as I say, are our specialty. This might be going over things that you very much all already know, but as I say, I feel it's really important to have this context just in case there are people here who aren't aware of this. Psychedelic drugs work, and it is kind of simplified, so I'm sure that some of you will have a much better understanding of this than I do, but forgive me, it's certainly in layman's terms. Psychedelic drugs reduce information filtering in the brain, and so they allow stimuli to reach the brain and to be consciously thought about that would normally be completely ignored. So when I'm talking to all of you, the pattern of the wood, as interesting as it is something that my brain filters out, and it doesn't factor into my consciousness, except now that I've mentioned it, of course. So there are, at a music festival, you've got loads and loads of stimuli, and they're all trying to be processed by the brain consciously. The brain is thinking about them, the brain is looking at that light, it's also looking at the grass, the pattern, what's the grass doing, why is the wind making it move that way. So it very much increases the potential for sensory overload. Mindset and setting are magnified as a result of that. So the kind of mind state that somebody's come in with, be they using drugs to enhance a pleasant experience or using drugs to escape from negative emotions or any of the other reasons that I mentioned, those can be magnified. So the ability to kind of filter out and shut off negative thoughts about something challenging that's going on in your life is reduced, and so you may be unable to help yourself from thinking about something that you really would rather not think about this weekend. So it's certainly something that can increase or create a risk of negative experiences. And similarly with a setting, if you're in an environment where it's really, really hot and there's a lot of people around you and you've lost your friends and somebody's got a weird clown mask on next to you, then that environment and that setting may cause you to, the negative emotions that come from that may be magnified. But equally, and the reason that most people take psychedelic drugs at music festivals, if the pattern in the grass is absolutely great and you're surrounded by your friends and the music is your favourite artist on and the light show is incredible and there's fireworks, then that is also going to be enhanced. So it's not, it's not all doom and gloom. So yeah, as I mentioned a little bit before, the visual disturbances that this can create can be extremely distracting, and generally an enhanced sensitivity, not just of visuals or mental aspects, but also of touch, smell. It's quite often we'll get people who are like, is my t-shirt wet? I don't, and they're and you have to reassure them repeatedly that their t-shirt's not wet, it's just 11 o'clock at night and it's kind of chilly and a little bit humid. So yeah, there's lots of kind of different sensations going on in the brain for people. So yeah, as I say, all of these generally desirable for people, and that's why they take them. They feel that the positives outweigh the risks, but certainly at times compounded perhaps by the recklessness or by something being missold as something else, it can get a little bit too much. And so that leads us into the concept of a bad trip. Now, I have to say I'm not a big fan of the word bad trip, because very often patients that come to us who are having what I prefer to call a difficult experience can come out of that experience with an overall, a net positive outcome. They may not be having loads and loads of fun, and it may not be the reason that they chose to come to the music festival to contemplate some deep-seated psychological issue, but if they're able to break past that and be a stronger person at the outcome of it, then I would personally not automatically write that off as being a bad experience, but certainly, yes, it can be a difficult one. And so we get a lot of, so there's a very wide range of drugs, there's a very wide range of possible causes that we've covered for people that may cause them to come a little bit of cropper, and so as a result of that there's a very wide range of symptoms that people may present to us with. We will see any or all of these in one patient depending on the severity of the case, depending on their background, what they've been doing that day, where they've been, have they been brought to us by security, kicking and screaming, or have they just kind of checked in and sat by our fire and realised that things are actually a bit more intense than they'd like. So general discomfort is probably one of the lower level issues that we deal with, sometimes referred to as body load as a result of drugs, and quite often effectively treated by dancing. A little bit of kind of muscular tension, people aren't necessarily going to stand around stretching at a music festival, but it can be quite easy to convince them to come have a little bit of a dance with you, and often they'll sort of be like, oh, I do feel better. And then 15 minutes later they're like, you know what, you can go back to Cosmic Care if you like, because I'm staying here. And they've got a big grin in their face, and you're like, success. So time distortion, on a kind of, not talking about a difficult trip, but on a general level, it's a very common effect of psychedelic drugs, and it's something that people may find desirable. If you're at a music festival and time becomes dilated and you feel like this incredible night has lasted your entire life, that can be very pleasant. But if you're having an unpleasant time and it's lasting what feels like an eternity, that's pretty awful. So one that we have the potential to deal with. Thought loops it's quite difficult to kind of explain why they happen and really what's going on in people's heads, but generally the way that they present to us is that they will be talking about one concept, and the conclusion of that leads them onto another concept, which leads them onto another, and then they find themselves back at the initial concept. And so that can bring about, in a positive trip, can bring about a feeling of sort of kind of oneness and intellectual curiosity, but in a negative trip where you really don't want to be thinking about the grain of wood on the table, that can be really unsettling for people, the feeling of an inability to control their own thoughts. And so that comes into the sort of feeling of insanity as well, where people don't feel like they're in control of their own mind. It can be really unsettling for people, and that may be a reason that they come to us. Anxiety is a whole spreading spectrum of sort of possible symptoms that come from that, and a severity of cases. It may just be that they're a little bit nervous about something. It may just be that during the come-up of a drug they are struggling a little bit, or it may be really crippling anxiety that means they don't want anybody to look at them or anything like that during the whole of the festival. So yeah, quite a catch-all one there, and that leading into panic attacks as well. I don't know if any of you have ever had a panic attack, but it, at the time, is a horrible, horrible experience where the body just kind of goes into overload from adrenaline, and that causes you to panic more, and it's a positive feedback loop essentially, and is a really horrible experience. And again, that can be magnified by psychedelic drugs, where the information filters are down, and so people can't stop thinking about the concern that they might have another panic attack, and it goes on and on. So aggression, something that it's certainly not an inherent property of psychedelic experiences, but it is something that we sometimes come across patients who are exhibiting aggression, especially if they've needed to be restrained by security for whatever reason, Sometimes security are great and they will only restrain people if they're naked and running around and crashing into people's tents. Other times they can be a little bit heavy-handed, and that is generally, I mean, in my opinion, unnecessary and leads to further problems down the road, but security don't necessarily have to deal with that. So it can be very challenging for us to treat, but it is something that we're kind of used to, and again, we need to be relentlessly kind in these situations. If somebody is kind of being a bit aggressive towards you, it's not something to take personally, it's not something that you've done, it's just that's the way that their trip is, and hopefully we can reassure them and make them feel safe to a point where they will let their guard down a little bit and realise that they don't need to fight us, because no matter how many times they swear at us, we are still not angry with them, and there's just kind of no point. So the feelings of insanity, something I touched on a little bit before, but yeah, just a general inability to control one's thoughts, and often accompanied by a concern that they will never be able to control their thoughts again, that the experience will never end, which, if you're having a negative experience, and again, coming back to time dilation, you feel it's going on or going to go on forever, then that can be really, really unsettling. Paranoia is another one I touched on a little bit with the sleep deprivation, but it can also be a direct drug side effect, especially from stimulant drugs, which we will deal with from time to time. It can introduce some real challenges for us, because a paranoid patient is very difficult to win the trust of, and so to try and get them to connect with you and start to let their guard down a bit and work through an experience can be really, really difficult. And difficulty communicating or unwillingness to communicate, again, kind of feeds into something that can make things really difficult for us. If somebody is that far gone that they are not able to verbally communicate with you and won't really even open their eyes, then that can really make things difficult. Trying to understand what you can do for them with regards to helping them, whether or not they necessarily even want or need help, or maybe they just need to kind of lie down and enjoy the experience, perhaps. And then ego death, finally, kind of can feed into the feeling of insanity, where the person loses the concept of what makes them them and who they are. And so suddenly a question like, did you come with any friends, becomes an existential quandary where they spend 5 or 10 minutes thinking about the concept of what is the you that you are referring to there, and am I in control of this physical body that my, oh yes I am, and so it can really be difficult to get through to someone if they can't even grasp that concept and stay on track. So a little something to touch on for us here, and a question that we do sometimes get asked is, why not leave it to the medics? None of the symptoms that I covered there are typically seen as symptoms of kind of trauma and general issues, and so medics who are very used to dealing with kind of first aid and injuries and bits and pieces like that might not be experienced dealing with psychedelic drug issues, especially if they're a general event medic. They don't necessarily just do music festivals, maybe they do public events, fates and stuff. They don't have people presenting to them who have lost the concept of who they are, and so we have that experience that hopefully allows us to really, we have that specialisation at the end of it. We take a very non-conventional approach, as you will gather as I go on. It's something that we might, and the medics might not be able to do, they might not have the time to do, they might not have the resources to do. We do charge for our service at music festivals, but it is a pitifully small amount, and so we may be able to provide an event with a service that has a large number of volunteers who can handle cases where a person is not in real need of medical care, apart from the fact that they just need somebody caring to make sure that they're going to be okay, and reassure them and make sure that they feel safe and they have a safe place to feel those feelings. And we have a vast amount of experience, something I touched on at the top there, dealing with people who are undergoing psychedelic experiences, and we will often have experience ourselves among our volunteers with the sort of, on a personal level, not just treating patients, with the experience that they're going through. And so that really gives us an edge that medics may not have, and perhaps where medics do have, wouldn't be comfortable revealing that to their colleagues and saying, actually, you know what, maybe we shouldn't be restraining him because I've felt like that before and it didn't really help. That's not something that you necessarily want to, you know, I wouldn't bring it up in my day, I mean, it would be totally irrelevant in my day job, but I wouldn't bring it up because I wouldn't necessarily want to share that with my colleagues. And we have the ability, as I say, going back to the sort of large pool of volunteers in an event, we have the ability to keep a patient with us for the entire weekend if necessary, to help them stay in that really safe environment so that they can integrate and experience and understand what it is that they've gone through, and have some experienced people that they can talk to about it, who can relate to them and who can kind of help them work through it. So, yeah, just to touch on that before I start to go really deeper into our kind of method. So, every case that we come across is different. There is experience that we have that is more generally applicable to all patients, but there is no, and in the time that I've been with Cosmic Care, I've never come across one case where I thought, oh, this is exactly like that case 2 years ago when this bloke did that. There are so many different drugs, situations, backgrounds that people can come from that can result in so many different symptoms of the bad or difficult experience that they may be going through. And so, yeah, it's not an exact science either. There is no published literature on psychedelic welfare that we can... that's not true. There's no sort of peer-reviewed literature, I should say. There are no scientific studies that we can go to and go, oh, well, if a patient's presenting with this, then we need to do X, Y, and Z. We have to draw on our experience and draw on the experience of others to inform our treatment decisions rather than knowing what the appropriate treatment may be. Patients are very, so coming back to the information filtering issue that I touched on before, patients are very sensitive to external stimuli. So we need to be cautious about how we approach a situation and how other people who are around our kind of pitch area. We also have, not to mention this before, we also have a little fire out the front, and we'll have a sort of people who can come and sit around it. And so if somebody's being extremely loud and noisy and aggressive towards other people, then we don't have soundproof walls in the tent, obviously, and so that may impact the treatment of the patient. And equally, the space that we need to set up has to be a pleasant and inviting space as well, because if somebody turns up to our tent and it's like soaking wet and horrible and it looks miserable, just as bad as the tent that they've just come from, then they're not really benefiting from that, and it has the potential to continue them on an unpleasant experience. And the patient, so the difficulty to communicate can really compound things as well. As I mentioned before, if you can't ask somebody whether or not they would like a cup of tea, then they aren't going to be able to, you don't know. And they, even if they can communicate, they may not know whether or not they want a cup of tea, which sounds strange, but it's the sort of thing that you and I take for granted, but people come to us, they may have they may have never felt like this before, and so they don't know what it is that's going to make them feel better. And so again, we have to use our experience and use others' experience to guide our decision and try a number of approaches and see what sticks sometimes. Yeah. So and this is why I really hesitated on the fact that there's no published literature, because there is actually loads of published literature, it's just not published in journals. So we have the Manual of Psychedelic Support, which is a really great resource which was released last year, which goes into loads of depth talking about exactly the kind of work that we do. Don't worry about scribbling all this down. I will be very happy to forward it on to you if you are interested. And it is also sent to all of our volunteers, so I'm sure they will have already read it. So we have the Manual of Psychedelic Support, which is written specifically for psychedelic welfare services by MAPS and a number of other organisations. Karen, our founder, has also, I think, written a chapter, certainly had some input in it. And then we have other resources which are very much less like kind of tailored for what we do, but we'll also have relevant information that we can use to, again, inform our choices when we're treating a patient. So there is some good literature out there, and as I say, we send this to all of our volunteers after they make their first application, and then also after they complete their application, just to try and get them to read some of it. So our kind of first steps when we receive a patient into our care, they may come to us from the medics after, so they will be brought to the medics by whoever, and then the medics will assess them, see that they're physically fine, but recognise that they still need further support, and that they may not be able to give that. People may be brought to us by security, people may be brought to us by their friends, and they may self-refer if they're aware of what our service is, which is one of our major challenges, but I won't go into that on this slide. So we will, if they haven't come from the medics, then we will assess the patient to ensure they're physically safe. Are they rapidly deteriorating? Have they, in the 5 minutes while security has debriefed us, fallen unconscious? If so, then they will need, we'll need to make radio contact with the medics to get a medic to come to us, or to get the patient to go to them. And then once we've made an assessment of that, we'll start kind of our treatment. So our first step is to find out what drug they have taken and they believe is causing the issue, drug or drugs, how much of it they have taken or think they have taken, or might have taken, and the time that they took it, so that we can use our knowledge about psychoactive substances to understand how long they might be with us, and sort of what kind of treatment approaches we might take. Whether or not they've taken any drug combinations, so ideally the patient would tell us in this step, but very often we find that if a patient takes their antidepressant every day, it's not really a drug to them, it's just a thing that they do, a part of their routine, and so we often find that we will have to specifically ask them, after they've told us about any recreational drugs they've taken, do you take any prescribed medication? And alcohol is another one where they will often just kind of forget to mention it, and cannabis as well, because they perhaps don't see it as a drug, or where they do see it as a drug, it's a bit of a constant for them, and they don't think that it could be feeding into the issue that they're having. And then also we'll try to find out if they have any medical history, which might be relevant to the case. So diabetes, if somebody's hypoglycemic, then that's going to affect their behaviour, and is something that we would ideally have a medic to assess the situation. Narcolepsy as well, if somebody's been found passed out. This is something a bit more for the smaller festivals where there is a more limited medic allocation. If security have brought them to us and said, "Oh, he's passed out, can you put him in your sort of army tent and let him have a nap?" And the reason he's passed out might just be a genuine medical condition rather than an issue with substance consumption. So once we've got past that initial assessment, we will start to deal with it depending on how we see fit. And and so there's a very wide, as I said, a very wide variety of symptoms that we may come across, and again, a lot of that has been looking at very severe cases, but there's an even broader spectrum outside of that where we have the less severe cases that we may deal with. So there are loads and loads of possible approaches that we may try, but the kind of central tenets of what we do is that we never give medication. We aren't qualified to give medication. It's not the approach that we are there for. It's not the approach that we want to take. In a vast majority of cases, it's not necessary to give somebody a diazepam IV, because actually once they're in somewhere that's really warm and safe and calm, they just tend to calm down naturally pretty quickly. We don't try to talk patients down. So we are very happy for an experience if somebody's not in physical distress. We're happy for that experience to play out if it needs to, and if the patient is happy for that. We're not trying to say to them, come on, you need to sober up. If they want to lie down and let their experience take them wherever it takes them, then we're very happy for that. And so this plays, we're sitters, not guides. This plays into the point that I said about religion. In the sort of shrine in the middle of our sanctuary tent, there are no religious items. When we are treating a patient, we're not trying to take them down a particular pathway of thoughts. We're not judging them. We're not telling them things that they should be doing or should be thinking. Again, we're letting their experience play out as they need it to, and we're there for whatever it is that they need from us. It could be potentially easy to say, well, why don't you push them towards a positive thought about X or Y, but it becomes a bit of a slippery slope of where do you draw the line, and where are you starting to kind of project your own thoughts and feelings onto them. So that's the kind of guideline that we give, is that we are sitters, not guides. And changing the set and setting is something that's really important to our work, and a really key tool that we have access to. So straight away, as I showed you before, the setup, what we try and do is have a really, really welcoming setup. So they've come from whatever setting it is they were in before, be that a crowded, noisy dance tent or a muddy tent, their kind of accommodation tent. And they've come from that into an environment that is warm, that is dry, that has smiling people who are, you know, if you need a cushion, we got cushions. We're there for them, and that to try and reassure them and make sure that they really feel safe. And so again, a nice sort of soft environment. Straight away there's that setting that's changed in the night that will be softly lit with sort of fairy lights, and to try and make it a pleasant place where people straight away, the setting and the set are doing work for us. So the ultimate goal of all of this is to get them to ideally return to the party. We don't want to have to send people home. We don't want to call the police. We don't want them to have to go to hospital. Sometimes that is a necessity as a part of the treatment, but the vast majority of cases we are able to treat in our facility and get people. Maybe it's within an hour, maybe it doesn't happen until the next day, maybe it takes a couple of days that they kind of are in and out of our care. But that is our goal. We want them to enjoy themselves. We're not going to send them home from the festival as soon as they've recovered because they took too many drugs, and therefore we don't want them on site. It's not. We are very much not here to judge people. So that is another really central part of our approach. Is we neither condemn nor condone drug use. We're just here to care. We may not choose the same pathways that other people choose. We may not decide to make the same decisions that they do, but they have, and we aren't there to judge them for it. We're just there to get them back to a state where they are happy and safe and can kind of go forth and do what it is that they need to do. Listening is a key part of our approach as well. not just listening to what people say, especially because they may not be particularly verbal, but also kind of tuning into their body language, their facial expressions, what their eyes are doing, and using that again to try and inform our treatment and what it is that we're doing for them. And so we allow the process to unfold. Again, we're not here to guide the experience. If somebody needs to think about a difficult experience in their life that they're going through, we're not going to try and necessarily distract them from it. We're not going to try and force them to think about something else. If they need to think through that, and we're there for them, we can talk to them about it, or we can allow them to kind of monologue and talk through it with themselves. So we acknowledge the individual's capacity to heal themselves. It's not necessarily the case that a patient comes to us and we provide treatment X and they are cured. It may just be that we are facilitating them working through an issue that they are having to try and treat themselves. We're there for them if they need it. We are there as sitters, not as guides, and so if they are able to take that pathway, we're very happy for them to do that. And again, as part of that, we are a place where if they want to lie down and go deeper into a psychedelic experience, then they are very welcome to do that in our care. We're quite happy to kind of leave them to it if they ask us, can I have an hour or so just to lie here and contemplate life? Absolutely. We'll come back and check on you if you want, or come and grab us if you need us. So, again, coming back to the not being sitters, not being guides, but sitters, we're not trying to direct people down one path. It's not a confrontational approach where we're trying to stop a thought process and make them think positive thoughts, if only it were that simple. We are here to allow people to facilitate them to think what they need to think. And it's a mutual learning experience for both parties as well. As I say, there isn't loads and loads of resources available, and no two cases are ever the same. So for us, we learn from patients as they learn from us while we're treating them. And not just necessarily about treating patients. We may also learn sort of things about ourselves. People can ask really striking questions sometimes that you wouldn't necessarily think of from an ordinary perspective. You're like, hey, that is actually a really good point. Why doesn't society do X or do Y? Some of it, of course, can be drug-induced thought exercises, but there's very much the potential there, and it's something that a lot of the volunteers will come across through their work with us. And so it can be an opportunity for deep transformation for generally for our patients. If they come to us, they have been working through some difficult thoughts, then they have the opportunity with us to really work through them and to get to the bottom of that and be with people who understand the perspective that they're coming at it from, and to help them work through it if that's what they need to do. So we really hope that not only is it a positive experience for them because they can return to the party, which is kind of their intention of being there for the weekend, but their experience of Cosmic Care can be positive because it can turn what is a difficult experience and is unpleasant from something that could potentially just be just unpleasant to something that could really, really help them in other aspects of their life, and as I said earlier, could really have like a net positive effect on them. So our kind of actual treatment approaches, I've been teasing this for the last 4 slides. When we get a patient in, what we really, really need to establish, once we've established that they're going to be okay in our kind of first steps, we need to create a bond with them. And that is something that is not always necessarily easy to do, especially, as I said before, with paranoid patients. Getting somebody to trust you and to open up to you and to be receptive to the kind of treatment that you're offering can be really challenging if they're extremely paranoid and they're unwilling to trust anybody. And as a part of this, what we say to our volunteers is that if you aren't able to establish a bond with somebody within the sort of first section of treatment, don't worry about it. Not everybody clicks with everybody else, but go and find one of your other shift members and say to them, I'm really struggling to work with this person, would you mind stepping in and you talking to them? And sometimes that can, again, it's kind of in a way, it's changing the setting, changing the external stimuli. A different cosmic care volunteer comes and starts talking to them, and sometimes you'll find that they'll suddenly open up, whereas the person before, they were really withdrawn and they just didn't want to talk to them. It's nothing personal. We don't know why it happens. It's just a part of how things work. So empathy is really important. As I said, it's important for us on a general level, but also that our volunteers can understand what people are going through, the kind of thought perspectives that they're coming into our care with. And so, yeah, being able to think, hey, you know, I've had this sort of thought pattern before. You know, what really helped me was thinking about X, or you know, just being able to make suggestions or things like that. So listening, something I touched on before, a really, really important part of our approach, and something that is absolutely key. It may be that a patient, particularly if they've taken a stimulant or an empathogen, might just want to kind of talk at you. That's absolutely fine. We are very happy to sit and listen, and you can kind of really get to know a person in a surprisingly short amount of time through that kind of type of treatment, and that can really help you to inform how you proceed with the patient to get them to a state where they're kind of happy and ready to go back to the party, or are working through to some other positive outcome. Gentle restraint, a little bit of an oxymoron perhaps. It is sometimes necessary for patients who are aggressive or extremely energetic, especially if they are posing a threat to other people at the festival. If they want to run around naked around the Cosmic Care site, we're not too worried about that, but when they start running through the staff area or the VIP area, and I haven't got any clothes on, the other staff at the festival will take a bit of a dim view, and so that's something that we would need to prevent. So what we will usually do is approach the restraint as perhaps it would be better to frame it more as an embrace. We aren't kind of trying to pin them down in a straitjacket. We're not holding down their wrists and ankles. We're perhaps more trying to hug them and just kind of keep them still and engage them in a way that doesn't make them feel like they're being trapped. So ideally it becomes a consensual process. They're perhaps able to let their adrenaline settle down a bit, and then they're willing to sit down and calm down a little bit more. So discussion is another one that kind of feeds into the listening part. It's very much a two-way process for a lot of patients. We will listen to them and not offer sort of our honest opinions where they are asked for, and so maybe we can offer some sort of useful nugget of wisdom, or it may just be the case that they want to just chat about stuff. Not everybody has a deep-seated issue that they are aware of that they want to work through. Maybe they're just feeling uncomfortable, and it helps them to chat about something a little bit unrelated, so they can take their mind off the body load or the muscle tension that they might be experiencing. Physical contact, so kind of feeding into the restraint one a little bit. It can be very reassuring to somebody, especially if they are finding visual stimuli overwhelming and therefore deciding to keep their eyes closed, to have their hand held or whatever, to reassure them that you are still there. They may not want to talk to you necessarily, they may not be capable of talking to you, but they may want some sort of calming presence, somebody there to reassure them if they need them. So hand holding is a really good way to do that. You might be lying down in the sunshine outside, thinking about an actual case that I've dealt with here. And so when I sort of felt like, am I really benefiting this patient? And I tried to pull away, he started to become visually distressed, and so it was clear to me that actually, yes, this patient really is benefiting from this, even though it feels to me like I'm just lying here holding his hand. Lots of different ways to apply that as a technique. Hugging is another fairly obvious one, maybe not for the entire duration of their stay with us, but certainly that kind of physical contact can be very reassuring for people. Sleep and rest, not a very exciting treatment method, but incredibly effective when a patient is able to sleep off an experience, especially if they are suffering from paranoia related to sleep deprivation. Obviously, sleep is a really good remedy for that. And for experiences with higher doses of dissociatives as well, and experiences involving alcohol, sleep can often be something that they really need after working through an issue with us. They don't necessarily have the energy to go back and hit the dance floor for another 6 hours, so they may choose to stay in either our sanctuary tent or our army tent to just kind of sleep things off. And then there's many more approaches that kind of don't necessarily come straight to my head, or that are kind of minor things that you wouldn't necessarily think of as a treatment, but might unknowingly help somebody. But the kind of general gist of all of the approaches that we use are that a patient needs to understand that they are safe within our care, that ideally we have very little interaction with security. Maybe they bring us a patient every now and then, but they don't hang around, because people often feel threatened by security, and so that undermines that feeling of safety. They need to understand that they've taken a drug, so in severe cases it can often be an issue that people don't, because they're not connected to the concept of them as a being, they're struggling to realise that the mind state that they are in is a result of the fact that they've taken a drug. And they need to understand that it will end, ultimately, be that as a result of just the effects wearing off, or be that because they've had a good sleep and they feel a lot refreshed from that. It's something that's important to reassure people about. And so, kind of a general theme there of reassuring people to help them feel a bit more grounded and a bit more comfortable in the environment that they're in. So, does it work? The vast majority of cases that